Hi, this is your favorite Dr. Kim, Roy Kim Plastic Surgeon, with another interesting question and answer about the best placement specifically above or below the muscle for your breast implant for breast augmentation. So there are three major ways of thinking about it. The most common way is under the muscle, also known as dual plane. The next most common method, I think, is under the fascia, and the least common is under the skin. So they're called different nerdy medical terms, and I'll explain. The thinking behind it is you want to have as little infection, as little scar tissue formation as possible, and a lot of times you want to have a little more tissue coverage over your breast implant. Remember, there's sort of three major layers to your breast. There's the skin, there's the breast tissue, and then there's the muscle. So under the muscle, submuscular placement, basically we create a circular pocket underneath the muscle, and technically the pectoralis muscle isn't a block. It's not a square. It doesn't cover your entire breast. So at the side here, some of it is technically under muscle as well as under breast tissue. So this is why we don't really call it medically or plastic surgery wise submuscular. We call it dual plane, two planes, under the muscle and under the breast tissue. So this is by far the most common way to place breast implants for breast augmentation. Another common way is technically above the muscle but under the fascia. The fascia is this whitish, clearish, sort of, I call it saran wrap or thick plasticky wrapping over the muscle. You can actually go above the muscle but underneath the fascia, lift up the fascia and put the implant in. So technically, yes, it's underneath the skin, but it's also underneath the fascia. This is why medically or plastic surgery wise it's called subfascial. The least favored way is under the skin. So it's above the muscle, above the fascia, underneath technically the breast tissue and the skin. And it is called subglandular, or underneath the gland of the actual breast gland tissue. So let me talk a little more slowly and in a more detailed fashion as to why the dual plane, the submuscular method, is the most popular. The reason why is there's the lowest risk of capsular contracture. Multiple papers have shown this. Capsular contracture is a very fancy medical term for too much scar tissue that forms around the shell of the implant. And so to avoid this, we want to actually not expose the implant to bacteria. So weirdly enough, even though we do surgery and everything's closed and healed up well, technically you can still have bacteria in the milk ducts, in the alveolar ducts of your nipple. So we want to put the implant as far away from the nipple as possible. So underneath the skin, breast tissue, fascia, muscle, that's a really well protected space, which is why we tend to put it there. I think the other advantage is that there's a lot of nice covering over the implant. There's skin, breast tissue, and muscle covering the implant. There's a disadvantage. If not done properly, you can have muscle and breast movement. So what happens is you can do a normal motion, like basically move your pec, move your arms, and you can see the implant move a little. This is a little worse if you do have thicker pec muscles and other conditions. So to avoid that, I do have a secret way, or maybe not so secret way, of avoiding muscle contraction causing breast contraction or breast movement. However, this is one of the known negatives or downsides to the most common way of putting in breast implants. Above the muscle and under the fascia, and remember medically it's called subfascial, the second way of putting in breast implants, the advantage is that it's not in contact with the bacteria. It's not in contact with the, remember, bacteria that are hanging out in the milk ducts. So it helps prevent capsular contracture. Also, the other big advantage I think is that with a lot of movement, people who lift weights, or you simply don't want to have the risk or an increased risk of whenever you activate the chest muscles, you have movement of your breasts. That's a great position to put it in. So we still create a circular pocket, lift up the fascia, create a circular pocket underneath the fascia, put in the implant. This is, to me, one of the negatives that's not being discussed enough. This technique was pioneered overseas in Brazil, and a lot of people in Europe and Asia still do this. They're putting in much smaller implants, much lesser volume implants. The implant width may be similar to what we're doing in America, however, the volume is a lot lower. Typically 200, 250, maybe up to 300 cc's is really what they're doing overseas. And just to let you know, that's a pretty rare size. America, I mean, typically we're putting in 350, 400, 450, sometimes bigger. And my concern is that it will not just stretch the fascia, it'll tear the fascia. So to a patient, it's not that big a deal. You're not going to be in that much pain. It doesn't look weird or anything like that. The problem is the implant is literally under the fascia. The fascia is no longer there. The fascia is torn, and it's in direct contact with the glandular tissue, your breast tissue. So by definition, suddenly it's not subfascial, it is subglandular. So that, to me, is not the best position to be in. Now, remember, I said the third way of placing breast implants is subglandular. So to me, that's the easiest because as a surgeon, there's not that much dissection anatomy. Without being too nerdy, we do create a circular pocket above the fascia, above the muscle, underneath the breast tissue. As a surgeon, hey, that's a great dissection plane. I can see everything, it's fairly rapid, and it's wonderful. The problem is long-term. The problem is the implant is exposed to all the bacteria in the milk ducts because the milk ducts are in the glandular tissue, the breast tissue. So this is why it's not a favored placement in my opinion. Multiple papers have also stated that as well. It's not a favored placement for breast implants in general. We, as plastic surgeons, don't love doing it. And not that many plastic surgeons do it on a consistent basis. So this is why it's not favorable, and I avoid it at all costs, and most of the plastic surgeons do. And so you notice if you do place it there, the advantage, honestly, is that since it's not attached to the muscle, under the muscle, every time you activate your pec muscles, your chest muscles, there's the least amount of movement of the actual implants when you move your chest. What's interesting though is that there's still gonna be some movement. So there are ways again to prevent that, but it depends on you as a patient and also the plastic surgeon and their techniques that they use. So pretty long explanation, but I hope you enjoyed learning about why dual plane under the muscle placement is the most popular. Under the fascia is increasing in use, but it does have limitations. And subglandular, or underneath just the breast tissue itself, well above the muscle and well above the fascia, is the least popular, least favorable place to place your implants. So, thanks so much for watching. If you have any other questions, please let me know.